we're going to talk about restrictive lung disease. Restrictive lung disease is a disease that inhibits the lung from fully expanding during inspiration or when you breathe in air. This can lead to dyspnea, which means simply difficulty breathing. Restrictive lung disease decreases and/or reduces lung volume as well. Because the lung is not fully expanded as it should, the lung volume is directly affected. Therefore, when the person inhales, less oxygen is getting to the lungs. Because the lung expansion has decreased, therefore decreasing the air volume. Restrictive lung disease leads to an insufficiency of air exchange due to reduction of air intake. Here are a few common syndromes that lead to restrictive lung disease. The Guillain-Barré syndrome is a syndrome which is when your own immune system damages your own nerve cells, which causes weak muscle cells. Therefore, the muscles in your lungs are not contracting and retracting appropriately. Another syndrome here is called Pickwickian syndrome. This syndrome is simply a system of things going wrong which leads to obesity. Obesity can lead to abnormal chest and wall deformities that can affect lung expansion. And the last but not least syndrome is infant respiratory syndrome, which is a condition in which premature infants lack surfactant, in return increasing surface tension in lungs, which can lead to restriction of the lung expansion.
Okay, so for the etiology, we have some causes of restrictive lung disease, which include interstitial lung disease, such as idiopathic pulmonary fibrosis. Another cause is sarcoidosis, which is an autoimmune disease. And a couple more causes are obesity, including obesity hypoventilation syndrome and scoliosis. And one of the final causes is neuromuscular disease, such as muscular dystrophy or ALS. All right, so some of the clinical manifestations that we see in these patients are dry cough, shortness of breath, wheezing, chest pain, and cough that brings up mucus or blood. These patients also have difficulty controlling their breathing, and they have repeated respiratory tract infections. We also see high blood pressure in the lung arteries and shallow breathing.
Now we're going to discuss pathophysiological consequences. Restrictive lung diseases are characterized by a couple of things: a reduction in lung size or an increase in lung stiffness, a decrease in the maximum volume of air that is able to be moved in and out of the lungs. Restrictive disorders may also occur as a result of mechanical abnormalities such as respiratory muscle weakness and abnormalities of the chest wall. Other systematic diseases are also known to affect the functioning of the lung, including rheumatoid arthritis, congestive heart failure, and scleroderma. Some more pathophysiological consequences are reduced total lung volume, reduced residual volume, reduced vital capacity, reduced FEV1, reduced oxygen diffusing capacity, and increased respiratory rates, but decreased lung volume.
The next thing we want to talk about is medical management. What usually happens is a patient goes to see their doctor with symptoms of coughing, shortness of breath, something like that. The key is early diagnosis. There is a better response to treatment if it's caught in the early. So at the initial doctor visit, you go in with concerns about shortness of breath or a cough, and oftentimes the doctor attributes it to factors such as asthma, allergies, maybe even a respiratory infection. So what happens next is if the patient continues to have symptoms, the doctor goes to the next step, and that's diagnosis. And the first thing that he would do would be the imaging tests, and we all know what imaging and x-rays are, so I won't go into that. The next, he'll order some lab work, usually a CBC, electrolytes, and also he can test for connective tissue disease, and that's in your ESR, CRP, and ANA. Then if the doctor wants to confirm suspected lung disease, he would go to the pulmonary function test, and this is something that we learned in lab. And the third or final thing he can do is do the lung tissue analysis, and that is a definitive diagnosis that can be made by examining a small amount of your lung tissue. And there's several different ways. You can do bronchoscopy, which is where they put the tube down your mouth and take a part of your lung. The bronchial lavage, which is when they insert saline and then pull it back out and get a sample of your lung tissue. So the next thing we're going to talk about is treatments. The doctor will usually prescribe medication for any type of lung ailment. First course is usually an antibiotic, and they are most effective for pneumonias. He may also prescribe a corticosteroid, and that is another first-round treatment for any type of pulmonary disease. Third thing he may prescribe is an immunosuppressant, but that's for short-term use, and there is little proven evidence that it works in a long-term situation. And you can also take medications that prevent the progression of the life of the patient, and you can also use medications that treat muscle spasms and pain. Oxygen therapy is often utilized, though oxygen can't stop the lung disease. It can make it easier to breathe and to do your activities of daily living. It also prevents and lessens complications from low blood oxygen levels. The next thing I want to talk about is pulmonary rehabilitation. There is such thing as exercise training, which would improve the functioning of your lungs. There's nutritional counseling. Certain foods may cause more mucus in your lung tissue, so that would be important. Of course, education and management training, ways to conserve your energy so you're not, wearing yourself out doing tasks that could be done more efficiently. And then other breathing strategies is long-term mechanical ventilation. There's the bilevel pressure therapy, different cough assistant therapies, and oral airway suctioning of the mucus that may cause problems with your breathing. There's other treatments such as psychological counseling, and there are support groups for those that have lung disease of this type. And of course, physical, occupational, and speech therapy. And then there's also, towards the worst case scenario, doing the feeding tube, because again, your nutrition can be compromised because you can't breathe. And your last resort option is lung transplantation. Most people who undergo lung transplant for this type of lung disease actually greatly improve their quality of life and their ability to exercise and participate in their daily life. So the prognosis. Of course, early diagnosis is more favorable in prognosis. Recovery or worsening depends on how severe the disease is and how well you respond to treatment when it's first diagnosed. Variables depend on the exact nature of the diagnosis. There's very many types of restrictive lung disease, so when you know exactly what you're up against, then it is has a better prognosis. Other effects related to lung disease, some patients develop heart failure or high blood pressure. The type idiopathic pulmonary fibrosis has the poorest outlook with a survival rate of only 4 to 6 years after diagnosis.
A person with restrictive lung disease does have the ability to expire or exhale normally. Restrictive lung disease only affects the ability to inhale and bring in enough oxygen. This disease does not have a particular gender, race, or regional preference. This disease is solely determined and diagnosed based upon the conditions of your lung tissue and its extrinsic environment. Here are our references that we used in all of the material where we got all of the information that was presented in this presentation.